Good evening, family. This is Shirley's World. Well, tonight we will be working in conjunction with Friends of ADOS channel, a new channel that has been launched out of Los Angeles of the concern of the monies allocated for illegal immigrants versus American citizens, and specifically African American citizens. There's two parts to this video. The first part is as soon as Angela does go live, we're going to take this show directly over there. In the meantime, I wanted to give you an update about what is going on in Los Angeles. Eric Garcetti announced today that there may be what they call the immune card. And I wanted to share that real quick before we change our broadcast over to the ADOS channel. But the immune card is something I think you need to pay attention to. Here we go.
Asking the questions tonight. Thank you to John and to Alex as well. So Alex, an immunity card is an interesting thing, and it's something we certainly are looking at closely. But it also depends on how many people are quote unquote immune. The blood test, the serology test that we will need to see whether people have had coronavirus, and that researchers are still trying to confirm, but early research shows that it probably should provide at least some immunity in the medium term. We're still not sure how this novel coronavirus will act and COVID-19's impact will be. It could be like a cold that you develop some immunity to, and in future years, when it either changes or when that immunity wears off.
So what an immunity card is a card that they're saying that you're going to need to work by. Now, I want you to listen. He just announced this today. He's at Crenshaw Christian Center, which is out of Los Angeles, which is my home church. They are working in conjunction with Garcetti and the city of Los Angeles now, allowing them to do COVID-19 testing. The immunity card requires blood testing. The blood testing for COVID-19 will be different than the nozzle testing. It's a total different testing that's required. With this immunity card, it'll allow you to have different levels of working.
You could be susceptible again. But if we could have that, it would allow us to, as we've seen in other cities, for instance, in Wuhan, China, they have a green, yellow, and red system. Red means that you still are susceptible or that you potentially have COVID-19. Green is that you have this immunity, and yellow is that you're in a quarantine state. This would be something.
Now, he said, now in other cities, now grant you, Wuhan, China is in China. China operates under communism, dictatorships, authoritarianism, ideology, and law, citizens that have to abide by that law. Here's a man in America telling us that in the city of Los Angeles, we should pattern ourselves after a city. Listen to what he's saying. After a city that is controlled and ran by dictators of authoritarianism, of a communist regime that is requiring you to have a card of different colors to determine your level of infection and how much they will allow you to be exposed to the people of your livelihood.
Something that would allow more people to go to work, allow more people to go to school. But my worry is that our success here in flattening the curve, while the best news is it saved lives, it also means most of us have not been exposed to the coronavirus and COVID-19. So we're going to also need more than just immunity passports to get some of us back to work, back to school.
So he said, not only will you need an immunity passport, we're going to need more. Now, what is that more? Because what they're doing is layering government on government on government. You understand? That's socialism. Because you have President Trump saying, you're free to go back to work. Let's open up the city. Let's get back to normal. But I passed the power to the governor. The governor is passing the power to the mayors. And the mayor, Garcetti, is making a statement that, oh, I'm going to limit you people on what you're able to do without this passport.
Cool. And back into spaces and places, because we can't wait for the entire year. We can't wait for 2 years. We're going to have to figure out tracking and tracing. We're going to have.
That sounds familiar, right? Tracking and tracing. Oh, that's what y'all do to Black people.
More testing like this for who's infectious, because for the immunity passports, it's a different test.
Who's been hit COVID-19 the hardest? Who's been most affected? Oh, that's right, Black people.
It's a blood test, but these
blood
tests help us know if you're infectious right now. And we're going to need to be able to surveil really quickly the entire community. So knowing there's a hotspot in one neighborhood and potentially closing that off, keeping some people who are special.
Did I not say this 3 or 4 years ago that they are going to determine what communities are more infected than others? And now they're talking about shutting your community down. Oh, this is more of a hot spot. You want to stay away from these people. If that's not racism, I don't know what is. If that's not being biased or judgmental, and determining that these tests are not federally regulated but state regulated to determine the quality of people or in what communities and if you can come over.
Especially vulnerable, like our seniors and people with pre-existing health conditions, may be home longer. But it is definitely one of the arrows in our quiver, one that I hope that we can use. And I hope in the next few days to share more news about our more formal process of how we're going to have those conversations about reopening the city with the county, neighboring cities as well, Southern California, in the weeks and months ahead. Thank you.
What kind of America are we moving into? It really determines on how you as the constituents have to control your local legislators, because this man is cuckoo for Cocoa Pop. Good evening, people. You're watching Shirley's World. My name is Shirley Hussar, the CEO of Urban Game Changers, where you make a decision to go in the communities and make a difference. But if you're not conscious and you're not awake, you're finding that we went from Trump to Garcetti, went from Trump to Gavin Newsom, which is governor. I'm using California as an example. Forgive me if you're not from California. To then we go to Eric Garcetti, who was telling us that we're going to need special passports to travel possibly throughout the state. And that's a problem. That is a problem. Well, you remember yesterday I told you that there's concerns about what's going on within the Black community, and that many of us are putting together some type of piece of legislation or a proposal together, and we've all been putting our minds together. Don Page yesterday came up with a really interesting COVID-19 evaluation, which I find very wonderful to read, and I want to share this with you. And then I know that we are going to coincide our page with another YouTuber, and we're just going to watch her channel, and I'm going to step out of the limelight. But I wanted to read this article to you. So let me go ahead and share this with you. And it's talking about our people and what's going on with our people, because this is important that we understand how badly we've been affected by COVID-19. So this was written by Don Page, and Don is talking about almost 500,000 people affected by COVID-19 since Christmas. And remember, I told you China knew about this since September, and they didn't tell anybody. This is why President Trump cut off the WHO, the World Health Organization, because their job is to inform us, and they didn't. Here we go.
448,000 Black Americans dead from COVID-19 by Christmas. Concerned Black American citizens calls for $2.4 trillion in COVID-19 relief for Black descendants of American chattel slavery. Scientists have determined that the COVID-19 virus infects humans indiscriminately. On a call April 9th with the Congressional Black Caucus, Dr. Ebony Jade Hilton stated that over 1.4 million Americans would die by Christmas. However, as the death tolls continue to rise, the coronavirus has clearly identified the most vulnerable among us as its most perfect hosts: Black descendants of American chattel slavery, BDOACS, aka Negros, aka Coloreds, aka African Americans, aka Black Americans. While Black Americans represent 13% of those living in places releasing data by race, they have suffered 32% of the COVID-19 deaths in those places. Based on that data, Concerned Black American Citizens, an Adduced Family Interest Group, estimates that 32% or 448,000 Black Americans could be at risk of dying from coronavirus by Christmas.
Now, this is by this Christmas. See, we need to get heads up on what's going on in the country, people. While they're talking about reopening, we're still heavily infected and heavily pushed away and not respected. We're not being respected. And there's inside trading where they are helping the Latino community. Oh, we got to help the Latinos. Oh, we got to help people who don't make hardly no money. They got special benefits right now in California if you make $12,000 a year. That's because these illegals have come over here and they've saturated us. I want you to hear a little bit more of this article. Let's see if I get this to play from here. Let's start from here.
Indeed, Historically specific circumstances have created the poverty experienced by Black America, and the health outcomes reflect these facts. That Black Americans are dying at exponentially higher rates from coronavirus is definitive proof of the compounding effects of pre-existing health and generational poverty in the Black community. The root of their existence, the racial wealth and income gap created by slavery, Jim Crow, redlining, mass incarceration and job discrimination. The infection and death rates are evidence of the specific devastation and harm resulting from structural and systemic anti-Black racism against the descendants of enslaved African Americans.
We've been dying already at a rate that we could not even imagine. To be at such, we were 55, 12, 30% of the population. And now we're 13% of the population. Are we going to get down to 8% of the population of this country because we did not come together and we did not push back? But instead, we have all these special programs for everybody else? That's a problem. That's a huge, huge problem.
African Americans, in particular, are more likely to suffer from health problems that are some of the main triggers for COVID hospitalization, including asthma, diabetes, and obesity. On each one of those health conditions, African Americans are above the national average by a percentage point or more, and farther above the numbers for white, non-Hispanic Americans. NBC News, April 12, 2020. Exacerbating this financial health crisis is misinformation about the disease, lack of priority testing, unequal medical care, and even exclusion from the CARES Act.
Now keep in mind, they're talking about two different type of testings now because Trump has empowered the state. In the state of California, they're going to do a COVID-19 blood test that would allot you that passport. That's a video I just showed you with Eric Garcetti. He is saying that there's a possible, it's not put in place yet, but there's conversation like in Wuhan, China, like in the city of Wuhan, China. And he just throws that out like it's nothing. The city of Wuhan, China, again, is in China, which operates under authoritarianism and communist regime actions, as well as socialist regime actions. We live under a democracy. Now, I know a lot of you guys are not political buffs, and you're saying, I don't know what that means. I don't know what that means. You got to break this down, stop me from talking, and then we'll go back and watch me later and study what does authoritarianism mean? What does communism mean? Because they already treat us in that matter in a country that's supposed to be free of the home, the land of the free and the brave. Well, this ain't no bravery. This is some dictatorship madness. And what you're going to see is unless you wake up and vote these state people out of office that are anti-America, because that is anti-America, to set your guidelines on a country that is anti-American and that's communism to run the people. That's a problem. That's a problem. You already came here talking about putting people in pods. And now you're talking about making them do blood tests on top of the COVID-19. But it's very interesting because they might start really testing this out. You remember, we're the test ground, right? They like to test on Black people. They're going to test on us. Listen to what I'm saying. Pay attention, get the thumbs up, share this video. They could possibly test us out as an example to the rest of the country. And we'll be used as the Petri tree type of people. Meaning what? Oh, well, let's just go test these homeless people. In order to maintain you staying off of the streets, we have to do a blood test. We have to test your, so you just say you're homeless, you want to test your health, they're taking your blood and they're determining COVID-19. And then you heard them also say in that earlier video that they're going to section you out a certain section. That is a problem in America. Let's go on. Let's continue on with this sister's article.
Further, concerned Black American citizens reject Surgeon General Jerome Adams' recent admonishment that the African American community step up and stay away from alcohol, tobacco, and drugs. Sadly, each of these vices are made readily accessible in Black communities nationwide. There were no calls to eat fresh produce, to exercise, or pledge to eliminate food deserts. There were no promises of priority testing or mass N95 mask distribution. There was no announcement of a targeted informational campaign. There were no assurances. As with the 1980s crack epidemic, Black Americans are now being scapegoated for bringing death to their own communities from foreign lands they have never set foot upon.
So, let's look at the history of Los Angeles, up and down Crenshaw, Western, and Normandy. And I'm a native, so I can tell you, I know these streets. We've always been endowed with liquor stores and Jesus churches from one corner to another. Well, if you go today in 2020, all that has switched over to what? Weed shops. Here's a green cross, here's a green cross, here's a green cross. Not things to embetter a culture of people, but because we are the weaker species. And I'm going to say species because they don't treat you as human anyway. So these are subhuman people. This is how they treat Black people. You're subhuman anyway. You drink alcohol, you smoke, you do drugs, and sadly, each one of these vices lead to death within our Black community nationwide. But why is that? Because the local leaders and the people have tolerated with being not only treated that way, but also not demanding for better livelihood, not demanding for, we want better produce, we want better community, we want limited access to marijuana in our communities. And there's people say, oh no, I smoke my weed. That is not helping your community. I'm sorry. When every fourth corner on Crenshaw has a green cross as you go up from, let's say, Martin Luther King all the way up to Florence, that's not helping the community. And if you really want to better your community and your life, you would not want them to make another epic center of like we did with the crack cocaine era of the 1980s. But see, this is a pattern that we're having. See the patterns from the 80s. See the patterns from the alcohol and the drugs. These are patterns. How do you keep Black people oppressed and basically subdued? And how we're going to do it now? Now we're going to test your blood with COVID-19, and we're going to give you a crossing pass. That's what Eric Garcetti's saying. Y'all need to pay attention. I'm not making this stuff up. You need to stay woke. Don't sleep at the wheel. Listen to this video.
Racial hatred and discrimination are the root causes of the generational poverty amplifying of the impact of the coronavirus on the Black community. Decades of the Democratic Party's benign neglect policy and the Republican Party's Southern strategy has allowed this country to fail paying its debt of land inheritance, legalized redlining into overly crowded, environmentally hazardous food deserts with poor transportation and no hospitals. The disparity of resource allocation in Black versus white communities is stark. This means we will suffer disproportionately from the negative financial consequences associated with having scant resources, while bearing the greatest risk to our health by leaving our homes.
Now keep in mind, we're talking about land, we're talking about location, we're talking about why is New York and certain parts of those parts of America having inherited problems. Part of the problems is the layering process. And I shared this with you before. When you have certain states, because I'm from California, we always had houses. But then I start learning about Detroit, or if I learn about California or Michigan, where these people live in these compounds where you have 200, 400 units. A lot of these units have shared air vacs. What does that mean, Shirley? Haven't you heard when people be in an apartment complex and they say, oh, the air's off? That means the whole building is off because the air unit supplies air conditioning. There's one unit supplies air ventilation for the whole building. Where, well, the problem is with COVID-19, that's shared air. That's shared air. Write that down, shared air, shared ventilation, shared heating. So when COVID-19 hit, anyone sick in that building, it was easy to transport the virus. It was easy to see that virus start to move rapidly because you're sharing the same air, same ventilation system. And we're talking about decades of the Democrat Party negotiating policies that are not helping us. And also the Republicans not having Southern strategies, all these things with the police and our livelihood, as well as the bad food and how we live, as well as hospitals. Y'all know the stories of the Martin Luther King deaf hospitals that are out there, how we never had the right hospitalization. These are all strategies to keep you suppressed and subdued. Now you got COVID-19 and the rise of the illegals and more of the suppression and the death population takeout of the Black community. Y'all need to pay attention to this. This is affecting you.
Shins will also result in death more often in the Black community due to our overrepresentation among hourly workforce, where we get no paid sick leave nor adequate or affordable health care coverage. We are largely employed in front-facing essential positions where social distancing, one of the primary protections against the virus, is reserved for the privileged and not the Black American essential worker. Our position at the bottom of the economic ladder dictates this dilemma. Further, in the aftermath of Obama's Great Recession, Black American home ownership collapsed, destroying generations of accumulated wealth and inheritance. There is little cushion left to soften the blow of a fatal pandemic. Here at the beginning of the pandemic, already 50% of the homeless are Black descendants of American chattel slavery.
So, if we want to talk about structure, detrimental structure, things that are dividing, destroying us within our community, within the Black working. You remember, anybody see that article or that interview? And I'll probably play that in a second. Of this Black lady who's working in the hospital. Her husband was away. She's the only provider for her children. She's a nurse. And she found it very interesting that some of the nurses were strategizing and not telling the real truth of certain areas that was more exposed in the hospital, and they weren't telling the Black nurses, and the Black nurses were getting more infected. And so when she found out, she kept saying the other nurses were telling her, well, don't go there. Well, the chief person never told me that, but they're telling everybody else, but they're not telling Black people. See, this is essential in American Black workers, where you think these people are your friend. You think these superiors are going to be working in your best interest, but there's some underlying redlining going down there. There's some embedded racism within the workforce, which nobody wants to address. And that's what she's talking about here. And yet we have Obama era where he wanted to help illegal immigrants. Because he is an immigrant himself. You guys think this Black man cared about Black people. He's not African American. He's an immigrant. He's from Kenya. Okay. And him being from Kenya, what is primary to him are immigrants, not American citizens. And that's where we're missing out on the main points of why we don't have the same correlative history as President Obama.
Read more stories this month when you create a free Medium account. Become a member, sign, and get started. Anyone can publish on Medium per our policies.
Let me start. I'm just trying to. It went back all the way to the top. Lord have mercy. Okay, let's go down here. Okay, let's start there.
Repairing a specific harm done to a specific group. Black descendants of American chattel slavery. When the Civil War ended, almost 3,000 white slaveholders were paid reparations of $300 for every slave they emancipated. Beneficiaries of this windfall include Senate Majority Leader and multimillionaire Mitch McConnell. Meanwhile, ex-slaves were freed into poverty, sickness, hunger, homelessness, and abused by the U.S. government. The U.S. government's failure to pay to its debt of 40 acres and a mule to emancipated slaves led to over 1 million deaths of newly freed slaves from starvation, smallpox, and cholera from 1860 to 1870. Generational poverty has been accumulating.
Generational poverty has been accumulating in America since 1619 and continues to deepen. Sadly, in 2020, the Black community is facing again similar losses of life, financial and devastation of COVID-19. And I will give this link of this article so that you guys understand what they're talking about. They give you a relief proposal, and we're going to talk about this in a second. Let me go and just check out and see who's in the chat room. I appreciate you guys chiming in. Tonight, we're going to be talking about Black relief. Why do we need the relief? And some of our past history, because we have to understand the patterns that continue to happen to Black people. Now, I know you guys love the word reparations, and I do too, and I've said it numerous times, but after COVID-19, you're going to see other cultures of people adapt, saying, well, I need reparations. I need reparations. And again, the ideas and the concepts created specifically for Black people will be stolen. So reparations is going to be asked by everybody. So I don't know if that's the best word. The best way to address the COVID-19 for the Black community, from my perspective, is to talk about economic empowerment and labor laws given to, so that we are allotted money that federal government would give away anyway, to like they're doing to everybody else. They didn't have to ask for reparations, yet they got $125 million out of California. And now, according to this article, a couple of $1 trillion from different states combined combined. So these combined numbers are leveraging against you. Do you understand? That means that people who come into the scene and basically who have money, what they've done is if they didn't have money because of this program, they're able to step up and step ahead of you. They can step ahead of you. These foreigners are coming in here. They're going to take advantage of. You get a check from the governor. You get a check from the president. Because they're stealing Black people's IDs. Yes, they are. They're coming here, and the homeless people said somebody stole their Social Security card. So a lot of these Black people are getting taxed, and these Mexicans are paying taxes as if they are that person. And I've showed you those videos in the past. So if someone has stole your ID and your rights as an American citizen, that's a problem. We talked about yesterday how people don't have an address to say they live somewhere. Well, if you don't have an address to say you live somewhere, then what's that going to do? That's going to also put you where? On the bottom, because now you don't have an ID. So how are you supposed to get a check? How are you going to get a check of this COVID-19 from the federal government when you don't have an address? And you Sir 007 saying he's given a couple of his addresses away to help Black people. We don't even have a center to say, okay, this is a Black center. Say you live at the center and we'll collect your check. Something like this. Again, this is another way for y'all to make money, just to think about it. And to say, hey, you homeless, you need an address. We'll use your address and come here, give us your name, and you go ahead and say this is your address and get some money. But you have all these people stealing your IDs. What do you do with that? Because that's a problem. If you're going to continue to have other people be able to have better rights than you do, be able to be positioned and leveraged against you, and then we have no retaliation. And why do people like me and you, we don't have the biggest platform like some of these celebrities? Why do we have to be the one fighting for a better America by ourselves? That's the part that pisses me off. All these damn celebrities. Why aren't they the ones saying, hey, we got a red flag issue. We need to step up to the table. But instead, they're being pushed back. And they're being pushed back because they're not stepping up to the table to help us. It's all about them. So I think the conscious part is if we don't wake up as a nation of people and start putting concepts and ideas and thoughts, not only in conversation, but executing them, pieces of legislation that will execute us, then we're gonna be even further behind. We're gonna be less of a population of people. Hold on, I'm trying to find something online. I found it. Thank you, Jesus. I'm like, ooh, this is like, I'm having fun finding this article. I found it. Hold on. Wait. Okay. This was on the Breakfast Club. Okay, that one section of that, what I just played for you in that article was interesting because it talked about how people in professional fields who are African American are being redlined and red flagged and all the other little red things they talked about. I want to show you this article. I want you to listen to this Black lady. She went viral. You guys might already know this story, but I want to bring it to your attention again.
Wake that ass up early in the morning. The Breakfast Club. Morning, everybody. It's DJ NV, Angela Yee, Charlamagne the Guy. We are the Breakfast Club. Now we have a young lady on the line. We spoke about her earlier this morning. She was the nurse that quit her job, and her name is Melissa. Good morning,
Thomas.
Melissa. Good morning, Melissa.
Yes. How are you feeling this morning?
Peace, Queen. How are you?
I'm good. My cousin that lives in New York called me and she said, they're talking about you on the radio up here. I was like, what?
That's Shaniqua. Shout out to Shaniqua.
That's only my cousin Shaniqua, yes. That's only a small part of the story, what everybody's saying. There's so much more behind what forced me to make that decision. I mean, I didn't want to leave my job. That's the last.
Now, wait, Melissa, before you get into it, just for backstory, in case people didn't hear, you quit your job on Instagram Live. You're a nurse.
Okay, so for starters, when the coronavirus outbreak, came to our area, I've already taken care of coronavirus patients. I've already been assigned one of those patients. Okay. After that patient, it was a patient that was being tested for coronavirus, for starters. My concern, I even brought my concern up to the charge nurses, my team leaders. I'm like, hey, here's a part of the story that people don't know. My husband is in another state. He's not even here. Like, if I have to self-quarantine, who's going to watch my children? It's not the fact, because I have children. It's who's going to watch them if I have to be self-quarantined. That's the thing. After I took care of this initial patient, I felt sick the following weekend. like I was coming down with a cold. And all I could think about is, was this patient positive? So when I went back to work, I asked my team leader, I said, how will we know, or will we be notified if our patients come back positive? Oh, yours was positive. Your manager, the manager, I don't want to say her name, the manager should have sent you an email. I said, she didn't. I pulled it up then. We looked, double checked, no email. Everybody else that had contact with this patient, they're like, oh, she called us. She emailed us. I felt some type of way about that. I said, why didn't she contact me? Because, I should know. So then my team leader said, well, it's probably because you had the proper PPE on at the time of care. I did not feel comfortable with that because there have been reports of still contracting the virus, even with the proper PPE. So I, followed up with people I know in upper management. I even called employee health. Both said whether or not you had PPE on at the time of care, your manager is supposed to notify you. And I was never notified. Or I even approached the manager. She was very nasty whenever I asked her about it. And, I didn't get the answer I needed. In an email I sent her, she told me that the only people that were being notified were those that had direct contact with the patient prior to being put on enhanced precaution. I didn't feel comfortable with that. So I waited to see if somebody else might have had a similar situation, like one of my coworkers. And it did come. One of my coworkers, same situation as mine, on enhanced precautions at the time of care. Her patient ended up positive. She was contacted by our manager. And so I sent her another email asking her again, why was I not notified of my patient's positive status? And then that's when she said, call me. No, you're trying to say something in a phone call that you can't say in an email. That's what it is. You're trying.
She don't want to keep that paper trail.
Thank you. And that's what I was trying to do, a paper trail.
I want to stop right here because I am here. I just want you to hear the story. Now, I want you to see these patterns, how they treat us. Here's a Black lady. She's a nurse. She knows what she's doing. She was exposed. She's letting them know, I got 2 children. I cannot afford to be sick. I cannot afford to be sick. You know my situation. I can't afford to be sick. But y'all playing games, Miss Nurse, Doctor, so-and-so. And then she didn't want to expose the lady. She quit, but she didn't want to expose the lady. She should have just gone ahead and exposed the woman. Just if you didn't quit anyway, why quit? Expose the woman and say, I'm not being treated fairly. Why not push that card? But she did the latter. So let's hear an outcome of it.
Her, because she knows she messed up. She knows that she messed up. And so, I think that this was retaliation against me because I was on her ass about not notifying me. Okay, and let me just make it clear. Not one time did I bash my hospital. When I made that video, I wasn't thinking, oh, you still have your freaking badge on. There was so much that occurred before that video was made that pushed me to that point. So prior to that, all weekend long, my family, my husband, they're all saying, Melissa, we don't think it's safe for you to go in there because my hospital has one of the highest cases in the state of Georgia. My coworker, she even called me on the way to work. She said, I'm about to call and see where they have me scheduled tonight because if they had me going to the corona floor, I'm calling out because they're not making the travel nurses work these floors or float to these floors. They're getting paid the hazard pay. We're not getting paid anything. We're not getting paid anything extra for this.
So let me get this straight. Not only are they exposing you to coronavirus, ain't telling you who has it, who's not, in lieu of, like they said, what floor she's supposed to be on top of or not. They're not even going to pay you the hazard pay. See, this is what I'm talking about. If we don't start communicating with each other, we ain't even getting the crumbs on the table. We're gonna be dead. They send her on a death trap with no pay.
Okay, and it's not about the pay, but you're paying these other people $5,000. Why is this nurse? I don't know if the other floors are doing it. Why is she not sending the travelers, but you're sending your regular staff, and we're not even getting paid extra for it? So
question: nurses don't healthcare professionals don't get hazard pay?
Not in my area, they don't.
Now, Charlamagne, you just asked about hazard pay. Yeah, I asked do nurses get hazard pay. She said, not in her area.
Not at her job. Mm-hmm.
Right, we don't get it.
Yeah, but they were paying the other people, she said. So she said, I don't get it, and other people get it. Well, these are exceptional times. These are exceptional times. Whoever was part of that hospital should have gone to the federal government, should have gone to the governor and said, look, These are frontline workers. She's a frontline worker. Why would you not pay her hazard pay? The rest of us, we can't do what this nurse is doing. But instead, again, no one's fighting for her. No one's protecting her and gave her no alternative, but she had to quit.
So Melissa,
what do you hope to gain from all of this, Melissa? Like, what are you hoping to get out of all of this?
I wasn't trying to gain anything. I didn't even think it was going to spread like this.
Right, it organically went viral.
That manager needs to go. I'm not the only one that quit that day on my floor because of her. Yes, like I said, there's so much more to this story, y'all. When I gave her a chance, everybody knows details. They will know I made the right choice. This was purposely done because she knew that I was on her ass about not notifying me about my patient's positive status. That was wrong. That was
Melissa. Would you go work at another hospital right now?
If they place me in the right areas, of course. I don't want to be subjected. I was already informed by my charge nurses that I work with. They said they told the manager of my status, my prior medical history. And she assured me, she was like, you don't have to worry about being assigned to those patients. You never should have been assigned to that first patient.
Right.
They assured me. And so if I don't have to go to this other patient, why are you going to send me to a whole freaking unit of those?
So this is where I want to warn Black people who are in the medical field, because some of your coworkers might trip you up, and this will be their way of taking you out. They don't like you anyway. They're supposed to provide emails and communication guidelines of safety, of habitation for you. But like you saw in that sister's articles, these are just historical records, historical patterns that we're seeing done within the Black community from every aspect, from business owners to the labor rights to the nursing. And you saw what they did to that doctor yesterday. I showed you that video. He was his own truck, his own equipment, and he's trying to help us. And in the meantime, the evil cop comes along. I call them evil cops. Watch out for the evil cops. Come along, patrolling, and handcuff the man until, thank God, the man's wife came out with the ID. Here's a sister here saying, look, I'm not getting paid the full amount of money. On top of, she doesn't feel safe. That's what this is coming down to, right? That's why she quit. Because she feels a distrust, not only by her superior officer, but within that facility, that obviously she had to quit.
Those patients. Even the nurse that gave me that first session, she came to me and she said, oh my gosh, Melissa, you should have told me you're a breast cancer survivor. I never would have sent you to that patient. And she's the same one that was there the day I quit. This was purposely done and nobody can tell me otherwise.
See, this is a setup. These are patterns that, now her story went viral. How many other stories we don't know about? How many other patterns, underground racism and death tolls are going to take place within our community because of what is going on with COVID-19, and that we need to protect each other. See, she needs protection. We need protection. But instead, we're seeing monies allocated towards illegal immigrants who call themselves American citizens, who have stolen our IDs, who have stolen our homes, who have stolen our businesses, because they've been able to stack and rack, right? Over the years, they bring other family members here and they hire them. All the manager positions in California are ran by Mexicans. Even your utility bills are the managers most likely to be a Mexican or a Hispanic person. I'm not trying to be racist or biased. I'm telling you facts. That's detrimental when you're dominated by one culture of people and then you have the state caping for the people. This lady's not even in California, and she's dealing with the guidelines in her position of seeing how they are targeting her and trying to take her out through her health or dispositioning her and having her possibly become infected and die.
Yeah, I mean, the only way America can get the best out of their healthcare professionals is to treat them with care. If you all aren't feeling like y'all are being cared for, how are y'all going to care for other people?
I need to also add this. Last week, or the week before last, they've been floating an older nurse with a breast cancer history around, trying to keep her in safer areas because she usually works in the ICU. She had been working on my floor for a couple of nights. They sent her to the corona floor. That nurse manager called my manager and, trying to get her back on my floor. My manager refused. That manager told her from what I'm being told, we must not only look out for our patients, but we have to protect our staff as well.
That's
this
true.
Manager refused. It's a pattern with this person. So,
right.
Okay.
Like I said,
So it was something personal. So this was not something that's going on everywhere. This is just something that you feel like this manager made some poor decisions and had a personal issue.
Exactly.
Now, do you guys have the PPE? Do you guys have the necessary the PPE that you guys need?
There's a nationwide shortage, so we are having to reuse the same gown and same mask the entire shift. Prior to this outbreak, we didn't.
Personal protective equipment. That's what PPE means. Personal protective equipment. They have PPE? Because a lot of these people, remember, a lot of our equipment, we talked about this, and what we use on our daily basis come from China. So because we had gotten so caught up into this stuff coming over from China, now we're in a disposition, we don't have enough stuff. And if it does come over, we don't know it's contaminated. So we've had to make some changes in our uses of equipment here in America.
That was not the standard. And I don't feel comfortable with that, and neither do in same mask the entire shift.
Have the PPE? Do you guys have the necessary the PPE that you guys need?
There's a nationwide shortage, so we are having to reuse the same gown and same mask the entire shift. Prior to this outbreak, we didn't. That was not the standard, and I don't feel comfortable with that, and neither do like a whole lot of people. That's unsafe. I'm sorry.
So they're making them in her hospital reuse the same gowns and the same mask. That's not protocol, because they're short. So they're saying, go ahead and reuse it again. We've never done that. We've always disposed of that gown and got a new gown and disposed of that gown. You know, that little cover, something to protect them. See, even if you're not sick, listen to where I'm coming from. Even if you're not sick and then you're exposed to a nurse or somebody who didn't change gowns, who has it, you can get sick. This is why people aren't going to the hospital already. But, you know, this is what I want to know. Is this a pattern to take the Black community out? We don't have our nurses and our doctors able to do their job correctly. And now we might be exposed because they're not having the proper equipment to change over in heavy Black community hospitals. Come on now.
Right. I agree. I think this is an indictment of America's healthcare industry more so than it is an indictment of you. Well, Melissa,
we do appreciate you, yes, for letting.
You know, like I mentioned before, if we're going to sit back and we're going to have conversations about reparations and better ideas for reparations, how do we work through that? How do we work through that? How do we know that there's money going to be set aside? And then we have to determine, the question is going to be, how do you determine who's Black? Well, we know who's Black because the descendants of slaves, and I talked about that. It's not based on DNA, it's based on genealogy. And you guys can know your lineage. You should know where your mother and your grandfather and all that comes from. And if you don't, you need to go to ancestry.com. You need to go to different ways of doing your records. There's people who have gone down to libraries. There's different ways. I've done mine, and I've done those previous shows, so I'm not going to go into that conversation. But if we're going to be able to identify us as descendants of slaves for protection, then these are ways. See, these are all these different ways that they're coming at us to break us down. So I want to talk about a little bit of funny, and I'm not going to go into heavy detail, but I want to show you another article that was interesting to me because I'm reading so much stuff on a daily basis. It's a lot. It's a lot, but I need to make it clear that there are people who are not working in our best interest. And I want to have conversations with you guys. So I'm going to go ahead and put this in early. I want to hear your input on what's going on where you're at since our last conversation from yesterday, where we talked about, again, President Trump did that chess move and passed it to the states. And in the state of California, what they're doing is they're setting guidelines where they're saying they want you to have a blood test for COVID-19, and they're going to set their guidelines based on Wuhan, China, which is a communist authoritarian regime. If you are in Nebraska, or if you're in New York State, or if you're in Arizona, do you find your governor doing the same thing? If you're in Mississippi, if you're in Wyoming, do you see your governor starting to say, well, we've got to put money set aside for illegals and not for Black people? Is anyone who's listening in this room can tell me, is there any special guidelines put in place to offset the devastation of numbers that we've occurred within our community? Because right now, there's nothing on the table. There's nothing coming from the federal government, and there's nothing coming from a state level. I have started to see an article, so this article came out, so I thought I would share it with you. The ADOS people live who were supposed to go live didn't go live, so I'm going to keep going, but I do want to show you what was sent to me And I just want to hear how they talk about repairing and rebuilding. So how do we do that with COVID-19? So I wanted you to just hear some of the things that they are talking about and ask for money and what we can do.
COVID-19 Emergency BDOACS RELEIF Plan 1 Immediate Guaranteed Funding Van Emergency BDOACS COVID-19 Relief Plan in the amount of $2.4 trillion directly payable to non-immigrant Black American aka African Americans aka Black Americans and be subject to a 24-month review. A. Eligible recipients should be compensated by $6,000 per month, tax-free. B. Social Security recipients should be compensated an additional $2,000 per month, tax-free. C. Black veterans should be compensated an additional $5,000 per month, tax-free given discriminatory practices of the VA in addition to supplemental health care and mental health counseling. D. Minor children should receive $500 per month each, tax-free. Eligibility must be a non-immigrant Black American who has identified as colored Black African American on federal documents for the last 12 years. 2. Medicare health insurance coverage and supplemental health care for Black veterans. 3. Guaranteed grants versus forgivable loans of up to $25,000 or 2 times 2x business sales for the trailing 18 months period for micro businesses and sole proprietorships with no employee or collateral restrictions. 4. Increased funding for halfway houses, shelters for ex-offenders, and housing for the homeless.
I'm going to stop here because it does go a little longer. This is the challenge. I see one of the sections here where it says eligible must be non-immigrant Black American who identifies as colored, Black, African American on federal document in the last 12 years. To me, they should provide. Look, there's that new thing called the new ID. Y'all know about the new ID. If you don't, you're asleep at a wheel. You got till October of this year. If you want to travel out of the state, in order to fly, you have to have the new ID. The new ID requires your Social Security, your birth certificate. It also requires, I think, a W-2 if you don't have your Social Security number. And it also requires a piece of a document saying that you live, like a bill or some type to go with it. So I think there's 4 or 5 documents. The one that I find the most interesting is they want your birth certificate. I believe we should ask for 2 forms of ID. One is your birth certificate and your parents. Now, why your parents? Because some of these people can doctor up their own. But I believe if you're African American or you're Black, it should say it on your birth certificate. And if you say, well, it don't say it on my birth certificate because they changed that stuff and now people are gender neutral or that new generation doesn't have any, then you need to go back and do your homework because you can still order your mother's and your father's and your grandfather's birth certificate. So it should have a history background. That's really easy. Everyone Black. I mean, Black Family First. Put that up in the chat room right now. What do you guys think about that? Do you agree? I want to hear some comments real quick. Do you believe so we can identify? Let's talk about self-identification because you can start talking about how money can be distributed. But if you don't know who you can distribute it to, all this is null and void because you're already seeing how these people are being able to steal our ID. And then I don't know, I think you almost want to go to the next level of saying that you need ID and you need to do a quick 1-minute video. My name is so-and-so. I was born such and such day. And that they show that you're Black. Because just think about if some Hispanic or a person who has stole your ID, they'll go back and they'll start ordering your information and submit that document. And we still don't know if they're real people. So my main concern is if you're going to be allocating money out or ask for money like they're doing in here for a relief for Black people, how do we know these people are Black? That's the number one thing because you're going to see people starting to really, really steal money. They're going to really start stealing money. What's you guys' take on this? Do you think, hey, thank you so much, Lam. Do you guys think that if we're going to start identifying African-American, what is the best way? Because one of the first ways I'm thinking of course, is through genealogy, not DNA, because DNA shows everything in your DNA diaspora. That's not what I'm talking about. Genealogy is your mother, your grandmother, your great-grandfather, and so forth. That is the first start. And making it very clear, I am an African-American descendant of slave. And my people are oppressed the most with this issue. Another option too, just hear me out, is if you do the African-American descendants of slaves and the Pan-Africans. And why I say and the Pan-Africans, because we should possibly be correlating, because Africa is also being oppressed with discrimination. I don't know if you guys are under a rock or not heard about that story, what's going on within Africa and McDonald's. And Phil from the Advice Show did a really great show on there talking about how in McDonald's, they are discriminating. Can you believe this? They are discriminating. They'll tell you, let's see, African. Yeah, here we go. They're telling us that they didn't want to hire black people. I mean, let black people come into their restaurant. You know, if you don't nip this kind of stories in the bud early, they will expand that. And other companies will go, well, hell, black people didn't get mad. Let's do it again. Black people didn't get mad. Let's do it again. You cannot continue to let these stories get way out of control, people. Like the fact that that black man was able to do it, get arrested, and we didn't protest, and we're not protesting against this lady. See, they'll do it again. They'll do it again. So it's the same thing with what we're dealing with here in America. Africa is also dealing with their racism. So do we start thinking about African-American descendants of slaves as well as Pan-Africans? I'm just asking the question because I know y'all don't want to share no money, but I'm just saying, listen.
Well, remember the other night we had put up a live stream speaking about what happened in China to Africans in relation to the McDonald's, where the brother went in there to buy something, which I do not support McDonald's at all. I think it's trash food and it's very unhealthy. But just for the sake of the story, you know, this brother went into McDonald's and they had a sign that said that they wasn't going to serve black people. And this is a McDonald's, an American company. And many people was very upset, outraged, and wanted to hear a response from McDonald's. Well, now McDonald's has responded to this incident that happened in China. So after all of the outrage and people tweeting McDonald's and saying, hey, what is your statement? What are you going to do? Do you support anti-black racism? And if you do support it, let us know so we can go ahead on and get you in this boycott, divest, and sanction China movement that's getting started. Let us know. We need to sweep you into that. Are we boycotting Chinese businesses and anything related to China here in the United States and abroad? So McDonald's did respond and said that it is not representative of our inclusive values, and they have temporarily closed the branch. And as you can see here on the screen, it's closed. No one is inside the McDonald's. Now, they said after the incident, African officials had confronted China publicly and in private over the racist mistreatment of Africans in the Chinese city of Guangzhou. And as we saw how they just blatant with it, blaming black people. You know, after the tired old...
Now I got to play that one section. I want you to hear something. I'm going to play it again. Listen to what he's saying.
Inside the McDonald's. Now, they said after the incident, African officials had confronted China publicly and in private over the racist mistreatment of Africans in the Chinese city of Guangzhou. And as we...
In the Chinese city of Guangzhou, let me ask you, why would black people even go to China at this point? Why would you ever really need to go to China? China, when has the Asian community been so excited about black people? We know they shot us in the back in the day in the 80s. So here you are, you got black people in China, I've been told, being kicked out of their apartments, on the street, homeless because of COVID-19. And it didn't help when they elevated those numbers in California, or not, excuse me, in New York and back east, not California, back east, because of the livelihood. I told you, this is stack and rack living of blacks who are most affected. Now China has even more reasons to be racist towards you. And then you have the African nations who have opened up their cities and they have the resources to sustain on their own. They have the resources, meaning the oil, the gas, the gold, the diamonds. Africa has all that. So if you have all that, why would you let China come in and offer you their fool's money and then start buying up your country? And now you want to know why, and you can see how they don't like you. It's just like, this should be a wake up call across the world, that here's a culture of people that have a difference with you and show you their actions. China, not all Asian countries, but China, which is a reflection of how they feel about your people. Shout out to Phil from the Advice Show in that story, because it is important that we understand, as African-American descendants of slaves, that not only are Americans affected by it, but also other foreign countries are being affected by it. Census. Yeah, the census is another one. You know, if we go back through the Census Bureau, of the old days, I have looked up the Census Bureau, and that has also showed the records of African American descendants. That is the best way of doing it. And Answer Again has the best answer, because I think if people understood the Census Bureau and working in conjunction of your lineage, you guys need to know who you are first. Once you know who you are first, don't tell me you're Black and I want money and write me a check. I'm Black, I want money, write me a check. No, that's not good enough. Now that you're quarantined, I want you to take your time and slow your roll. If you're Black, white, or whatever is watching this show, you need to know your own lineage. You need to go to Ancestry.com, look up Ancestry.com, and then break down your lineage of knowing who you are. So if they're going to start doing what we're asking, they're going to say, how do you prove these people are Black? That's the number one question, because you could throw all kind of numbers and screens and statistics, which will be true. But then they're going to say, okay, if we do this, how do we distribute those funds? Think about it. That's what they're going to ask you. How are you going to distribute those funds? And then we as a people have to say, we can come back, because just like you've created the new ID, you can ask that same information through the new ID, and we will give you our birth certificate, because you're going to have to submit that over to get, if you drive, if you fly, they're going to ask you for your ID right now. That's the new law. That's a federal law. It's called the federal ID. So with that new federal ID, you might as well take it to the next level, and then provide maybe your mother or your grandparents. It'll say Black. It'll say African American. It'll say something that correlates to what the requirements are. And then you have your picture ID to correlate with that birth certificate ID. Then you should have, that should be a win-win chicken dinner right there for us. That should be it. That should be it, to be able to at least prove you are a descendant of slaves. Now, for those who may not be familiar, again, I'm breaking this down basic. I know it sounds crazy, but I want to show you the real ID, because that's an ID that's coming up. I think that we can use those guidelines as an example of where we need to be, so that we can get our contribution of the correction of COVID-19 that's killing us off. Because we do need money to correct our community, but what good is to correct our community if we don't understand how we need to identify each other? Because it is a hell and high water to get that ID, and you need to know how to do it. And if we say, okay, we've all signed up for the new ID, here's my name, here's my birth certificate, okay. And then for us, for our protection for ADOS, so that we know that these people are real Blacks, I think you need to go one more level for the ADOS people or the foundational people, and say, well, do you have also your parents' birth certificate? And then you can find that information. So then you're showing 2 generations, right? Maybe 3. The more generations you show, the more proof of the realism of who you are, before we can start saying, give us money for what has happened to COVID-19. So let me show you this real quick. If you guys don't know what the real ID is, this is a short video.
Beginning October 1st, 2020, a Real ID compliant driver's license, permit, or ID card will be required to board a commercial flight in the United States and to access military bases and secure federal facilities. However, alternative documentation, such as a passport or common access card, can be used instead. Not sure if you already have a Real ID? Check the upper right-hand corner of your card. If it has a star, then you have a Real ID. Real ID is a secure form of identification that meets federal security standards for state-issued licenses, permits, and ID cards. To upgrade to a Real ID, you must visit a BMV branch and bring the right documentation. If you don't already have a Real ID, you can't.
Now this is in a different state. They call it BMB. This I think this is Illinois. I don't know what state this is, but you go to your DMV department, your department where you go your driver's license. So that's what this one is.
Not renew or upgrade online, through the mail, or by phone. When applying for a Real ID, you must bring documents that prove your identity, name and birth date, lawful status in the United States, a valid social security number or proof of an eligibility, and at least 2 documents proving your Indiana residency.
Okay, so this is in Indiana. Now, it's the same thing nationwide. Your first is your ID, which is your birth certificate. Okay, your birth certificate, and then you need to have your social security number and a lawful state document saying that, hey, yeah, I live here. And then the last one for here is asking for, like I told you, showing your address or some type of mail that you get. And this is state by state, and you can go on YouTube and just see that these are the 1, 2, 3, 4 documents that you need. I believe that the same kind of structure that we need to have for descendants of slaves. I believe if we're descendants of slaves and we want to talk about compensation, then we also need to talk about the Census Bureau and being able to get that birth certificate and prove who we are as a people. What you guys think about that? Because by doing that, then we can talk about monies allocated. Let me go back to this article because I find the article interesting and I want to share this with you. Let's go back to this article and let's have this talk. Let's see. 1 second. We're right here.
Five, government subsidized 1% interest mortgage recapitalizations. 6, funding state mortgage down payment and rent assistance programs to reduce mortgage and rental rates at market levels from financial year 2000. 7, ex-offenders, regardless of legal status or criminal record, shall be eligible for all relief programs, grants and loans described herein or in the future and are not to be excluded in any way. Ex-offenders also imprisoned under the 1994 crime bill for marijuana possession should be compensated a minimum of $50,000 for each year that has been served. 8, emergency funding for K-12 educational support in the form of computer and internet access, year-round supplemental support such as tutoring and social services. 9, no federal taxes shall be assessed on any relief measures described herein, nor should any of these relief measures be garnished for payment of back child support or payment to loans or creditors, even in the case of the financial institution listed for direct deposit.
ADOS has gone live. I want to hear what Angela has to say about this article. Let's transcend right over to her and let's hear what she has to say. I know she has a lot of input on her feelings on this article, and we're going to go watch her show live now.
ADOS can't afford Obamacare work and get jobs, which he allowed on his watch. Uber blew up on Obama's watch. I know that's hard for you guys to hear because some of you worship Obama, but he is a part of the problem. The Democrats are a part of the problem. I said it. We have been their mules for almost 60 years, and we are on the bottom. Do you need any other evidence than that? Many of us lost the only wealth we had, our homes, under Obama. Mine was spared, but I'm in the fight yet again to save my home. So I can't stay at home, and there's a lot of ADOS in the same position that cannot stay at home because unemployment isn't answering the phone. The online applications aren't working. The federal stimulus can't come through because it's attached to the state. The state is talking nonsense out here in California to give $125 million to illegal immigrants, undocumented workers. That's my tax dollars, your tax dollars, if you're out here in California. And all the money for small businesses is gone, $348 billion. And nobody can tell me how many ADOS benefited from that. Ain't seen the stats for that. Who can afford to stay home? We are caught between a rock and a hard place, playing Russian roulette with our lives out here. Because no one's hiring. Sean Hill was on my show last Saturday, and he talked about LinkedIn. Look up Sean Hill on Facebook. He's got a website, increasemychecks.net, where he talks about how you can get in on the LinkedIn and do your thing. But if you need immediate cash, look into Instacart. It pays really well, especially when you're very respectful to your clients, okay? Use your professionalism and make it happen, family. And pray over yourself and your comings and goings, and wear your mask and gloves at all times. But we don't have a choice, family. Otherwise, they take our homes, right? They take everything. This is a second money grab for all of it. They're coming for what they left on the board from the Obama bailouts. They're coming for it. Don't you believe them when they say they're going to tack it on the back end? Don't believe them, family. Pay as much as you can so that you're not faced with foreclosure at the end of this. Who knows when it's going to be ending, right?
That's true. That's very true.
Moving on. We are largely employed in front-facing essential positions where social distancing, one of the primary protections against the virus, is reserved for the privileged and not the Black American essential worker. Our position at the bottom of the economic ladder dictates this dilemma. Further, in the aftermath of Obama's Great Recession, Black American home ownership collapsed, destroying generations of accumulated wealth and inheritance. There is little cushion left to soften the blow of a fatal pandemic. Here, at the beginning of the pandemic, already 50% of the homeless are Black descendants of American chattel slavery. Repairing a specific harm done to a specific group, Black descendants of American chattel slavery. When the Civil War ended, almost 3,000 white slave holders were paid reparations of $300 for every slave they emancipated. Beneficiaries of this windfall include Senate Majority Leader and multimillionaire Mitch McConnell.
I'm going right back in a second. Sorry, I gotta fix my screen because I want you to be able to see. She's got something showing, and I gotta take off this. Okay, I got that done. I apologize. Going back to the broadcast. Please pay attention to what she's saying, and I will be chiming in between.
Our ex-slaves were freed into poverty, sickness, hunger, homelessness, and abuse by the U.S. government. Full stop. This is what makes us susceptible to the COVID. Not Twinkies, not Church's chicken. What I just read you has set us up for COVID to make its home in our bodies and wreak havoc. The U.S. government's failure to pay it to its debt of 40 acres and a mule to emancipated slaves led to over 1 million deaths of newly freed slaves from starvation, smallpox, and cholera from 1862 to 1870. Generational poverty has been accumulating in Black America since 1619 and continues to deepen. Sadly, in 2020, the Black community is faced again with a similar loss of life and financial devastation from COVID-19. So, it is with great urgency and obligation that concerned Black American citizens calls for $2.4 trillion emergency Black descendant of American chattel slave relief plan, slavery, as in the institution, relief plan, that will enable the Black community to sustain and defend itself from hunger, homelessness, sickness, joblessness, and racial lineage discrimination. COVID-19 Emergency BDOACS Relief Plan. Number 1, immediate guaranteed funding of an emergency BDOACS COVID-19 relief plan in the amount of $2.4 trillion directly payable to non-immigrant Black American, aka African American, aka Black American, aka Negro, and be subject to a 24 months review. I keep referring to Negro because Obama took that out. And that is directly tied to the 14th Amendment, which is directly tied to our reparations. A, eligible recipients should be compensated $6,000 per month tax-free. B, Social Security recipients should be compensated an additional $2,000 per month tax-free. This is for a year, and then we'll review it. C, Black veterans should be compensated an additional $5,000 per month, tax-free, given discriminatory practices of the VA, in addition to supplemental health care and mental health counseling. D, minor children should receive $500 per month each, tax-free. Eligibility. You must be a non-immigrant, Black American, who is identified as colored, Black, African American, Negro on federal documents for the last 12 years. Number 2, Medicare health insurance coverage and supplemental health care for Black veterans. Number 3, guaranteed grants versus forgivable loans of up to $25,000 or 2 times business sales for the trailing 18-month period for micro businesses and sole proprietorships with no employee or collateral restrictions. Full stop. This is what they cut us out of with that small business solution of $348 billion. So we're making it up in this particular stimulus demand. 4, increase funding for halfway houses, shelters for ex-offenders, and housing for the homeless. 5, government subsidized 1% interest mortgage recapitalizations. 6, funding state mortgage down payment and rent assistance programs to reduce mortgage and rental rates at market levels from financial year 2000. 7, ex-offenders, regardless of legal status or criminal record, shall be eligible for all relief programs, grants, and loans described herein or in the future and are not to be excluded in any way. Ex-offenders also imprisoned under the 1994 Joe Biden crime bill for marijuana possession should be compensated a minimum of $50,000 for each year that has been served. 8, emergency funding for K through 12 educational support in the form of computer and internet access, year-round supplemental support such as tutoring and social services. 9, no federal taxes shall be assessed on any relief measures described herein, nor should any of these relief measures be garnished for payment of back child support or payment to loans or creditors, even in the case of the financial institution listed for direct deposit. 10, plumbing infrastructure shall be repaired if possible or replaced in BDOACS communities to ensure basic public health and sanitation needs are met. It is important to note the distinction between Black descendants of American chattel slavery and immigrants. Black immigrants did not arrive in America in significant numbers until after the Immigration and Nationality Act of 1965 was passed, and then primarily as students. The 1980s are when the Black immigrant population grew from over 800,000 to over 3.7 million today, with a median household wealth of $60,000 compared to $200 for Native Black American. They are more highly educated than BDOACS and able to access affirmative action. They benefit along with other majority minorities. Excuse me. White women and people of color or choice at the expense of whom the entitlements were meant. Median household wealth of Black descendants of American chattel slavery is expected to fall to 0 by 2053 as the slavery wealth gap continues to widen and now stands at 20 to 1. However, the arrival of the coronavirus has fast-forwarded that event to 2021. Full stop. Coronavirus has fast-forwarded that event to right now.
Wow.
We have no wealth. Do you have any wealth to leave your kids? We don't have any wealth. We need to stop these lies. 90% of us share $700 billion, and we've been wiped out by the COVID. 22 million unemployment insurance claims were filed to date and growing. What percentage do you bet that Black descendants of American chattel slavery are amongst the highest of the unemployed. And do you think those jobs will be there for us once the COVID crisis has ended? I don't think so. You better hurry up and learn how to become your own economy. Moreover, most of our households have already reached that bottom. Meanwhile, the median white household wealth at the bottom 20% of the income distribution is greater than the median household wealth of the entire population of Black Americans descended from chattel slavery. According to Moody's Analytics, 80 million jobs will be affected by the COVID-19 pandemic, and many jobs won't come back. Especially in customer-facing service jobs such as hotel and leisure, retail and fast food service industries, where BDOACS are overrepresented relative to other demographics. Black unemployment has been consistently and persistently higher than all other demographics, even before the COVID-19 pandemic took hold. According to concerned Black American citizens, it is imperative that a plan be put in place immediately so that Black descendants of American chattel slavery can survive, regain health, feed their families, buy homes, start businesses, and receive their rights of full citizenship as determined by the 13th and 14th Amendments to the United States Constitution. Like I said, family, this is the last portion of it where I'm going to give you our post-COVID demands. Nobody's talking about ADOS and how it relates in a post-COVID way. Well, we've got a demand for that. Post-COVID-19 BDOACS extension plan. Eligibility. Participants must be non-immigrant, Black American, who can identify one set of grandparents on the 1870 United States Census and must have identified as colored, Negro, Black, African American on federal documents 12 years prior to the onset of post-COVID-19 BDOACS extension plan. B, immigration records can be used as a cross-reference to verify eligibility. Number 2, continuation of COVID-19 emergency BDOACS relief plan, direct payments through 2031. I said it. Continuation of COVID-19 emergency BDOACS relief plan, direct payments through 2031. Full medical coverage, BDOACS, no premium or copays. Federal job guarantee, which guarantee employment to all eligible, able-bodied BDOACS. All employment would be compensated commensurate with training and experience and carry full benefits, federal employee benefits. Educational program designed to incentivize and train BDOACS in the medical field as doctors, nurse practitioners, mental health counselors, and midwives. Community health centers with BDOACS staff, community food pantries with BDOACS staff, fully fund United States Postal Service with BDOACS staff. Right now, the post offices out here in California are dominated by Hispanics and Asians. You rarely, if ever, see anyone Black working in the post office. Reestablish and narrow the definition of affirmative action by restoring its original purpose to set aside educational, job, and business opportunities for a group that has suffered discrimination based specifically on BDOACS lineage, not race or sex. Required that all colleges and universities that are designated as historically Black colleges and universities have a study body representative of 50% or more of Native Black Americans, no less than 15% of Black Americans represented in each department, and an administration representative of the percentage of Black American population of the city for which it resides. Establish a new government agency to administer the federal jobs programs and other social services to the BDOACS community comprised of the BDOACS. We need to be in charge of what we're due. Free public and private vocational, technical, undergraduate, graduate, doctorate education with guaranteed positions in their chosen professions. Number 9, ensure that no less than 15% of construction or public work contracts go to Black-owned construction companies that comprise of 50% or more employees that are native-born Black Americans. Banks, particularly those found to be legacy beneficiaries of the institution of slavery, shall be required to lend to BDOACS for home ownership and business loans. Banks will be required to provide semi-annual audit reports demonstrating equal access to capital. Any bank selling predatory loans will have to repay the excess interest earned in restitution for any financial harm caused by said loan. Number 11, 1% interest student and business loans. 12% of the total RFP contract dollar values on all federal, state, and municipal RFPs and contract bids must hire, engage BDOACS at a rate equal to the percentage of state or local population, whichever is greater, or a minimum share of 30% of local, state, and federal. 13, enact legislation making price gouging and fraud of BDOACS a federal hate crime. 14, establishing BDOACS as a protected class with all violent crimes against us being deemed as a federal hate crime. 15, immediately release all nonviolent criminals or persons convicted of victimless crimes that reside in private, local, state, and federal jails and penitentiaries. Re-enfranchisement of all BDOACS regardless of financial status. 16, forgiveness of all fines, fees, penalties, bails, and warrants for non-violent victimless crimes and minor drug offenses. 17, ban the box on job and housing applications to prevent discrimination against the formerly incarcerated. The last post-COVID demand, formerly incarcerated and the incarcerated shall not be excluded from any part of the extension plan. I'm in the home stretch, family. The circumstances of our poverty are specific to our shared lineage as the descendants of American chattel slaves. The institution of slavery, redlining, Jim Crow laws, lynching, state-sanctioned terrorism, mass incarceration, the 94 Omnibus Crime Bill, exclusion from federal programs, land grants, the New Deal, GI Bill, Farm Aid, and full participation in capitalism have decimated the BDOACS community. There is no immigrant group, legal or illegal, nor religious group that has suffered on any level or to the extent of 401 years of ongoing abuse, degradation, asset theft, and oppression as have Black American descendants of chattel slavery. No other group in America was kidnapped, bought and sold by its own government and its fellow white citizens. No other group in America was forced into chattel slave labor to build the foundation and infrastructure of the wealthiest nation in modern history, only to be deprived of legal compensation and inheritance. These facts explain why the heirs, Black descendants of American chattel slavery, BDOACS, live in the third world conditions that have made them specifically susceptible to death from the coronavirus, and why immediate action is required. Make this go viral, family. Share it with everyone. Urban Game Changers, American Descendants of Chattel Slavery, American Descendants of Slavery, ADOS, ADOCS, FBA, Black Family First. Every group should get this and make it go viral within their groups. This is for the nation. I know there's other initiatives out here working on local repair, but this is for the nation, and we are escalating this. If you have direct contacts within the CBC or the government, anybody in Congress, look me up under Friends of ADOS TV and Facebook and send me a message. You can also find me at Angela Nirvana. And I will put the information in the proper hands so that this can go further and wider than ever. Our goal is to get this in front of the most important decision makers before the ink even hits the paper. We are at DEFCON 4, family. The stakes are exceptionally high because the stakes are us. Thank you for tuning in. You make it a beautiful God-inspired rest of your evening. Peace, family.
And as I stated to you before, if we are going to work together as a family, as a culture of people, we cannot continue to tolerate. Wasn't that a powerful statement? Shout out to Angela Devada. She's an amazing person. She's doing a lot on the front line in Southern California. We will be working together. You heard her mention Urban Game Changers. That's us. We are a family. And I know many times we do a lot of ranting. A lot of times we do a lot of venting. But now we have to start setting some guidelines. My main concern in what we're asking for, from my perspective, and you guys can come in and tell me what you think, but from my perspective is that we need to make sure that our IDs aren't stolen, because these illegals are ruthless, man. They're ruthless. And so that's why I started reverting back to, I love what she said about, I said the same thing. We have to use our lineage. I love what New Again stated. New Again says, well, you can definitely use the Census Bureau. But like I mentioned, we have to do the new ID in America now. And there's a method to Donald Trump's madness, if people want to agree or not. The reason why President Trump put together the new ID and called it the real ID, the real ID, the new ID, the real ID is in place because there have been too many fake IDs out there. And there's been too many people stealing IDs. So they're making you go through the whole process of birth certificate, take a picture, come in. You have to prove that you are that person. You have to prove that you're that person. And if your birth certificate says Black American, and then all of a sudden you take a picture and you're Mexican, that's not no real ID. Boo-boo, that ain't no real ID. So what they've been doing already, the department in California, I've already gone in, they whisper to me because they think I'm one of them. And they go, well, you can go on 4th and Main, downtown LA, somewhere in Maine, and they give you a fake real ID. So the federal government is going to have to start looking out for these fake real IDs, because that's what these people are doing. They've stole our ID. So that should still work in conjunction of what we need to do first to set the premises of self-identity as a people first, and then start to address the issues of the money that needs to be allocated. Because like I told you yesterday, those numbers are real. Those numbers are real. And the African-American community has been hit the hardest. I know I normally do this at the end, but I'm going to go ahead and give you guys the link of this article that she was reading. And what she was reading was this article right here. And it's in the chat room right now. That's what she was reading. Black Citizens of America, the $24 trillion in money. We need to start talking about that. And then what she could do as well, as what I will work with her on, is that we need to correlate to those numbers from yesterday. Let me show you those numbers yesterday. Hold on a second. Oh, this is Angela calling in. Hold on. Angela, I'm live right now, but you did an excellent job. I just want to tell you that. Well, you were excellent. You were truly excellent. If you want to chime in on my show right now, I am live and I'm talking to the family, but I'll get right back with you. Okay. You did a wonderful job. I'll call you right back. Bye-bye. Okay, you guys, so let's go to yesterday's hold on. I had to answer that phone call. She was just called me. We got to work together. I don't know what is that we don't understand if we don't have a clarity of working together, because these people are working against us. And then we're on a time, it's a TikTok, because this will all be finally pushed under the rug, or all the money. See how the money's running out from the state? Is anybody paying attention to how all the money continues to be running out? Oh, we're running out of money. We're running out of money. How the hell you'll be running out of money? They running out of money when you think you got time to apply. And I've been pre-warning y'all, you need to be putting your applications in or whatever you need to put in, but they're running out of money. But what she's correlating this with is, see, why COVID-19? Here it is. Why are Blacks dying at the highest rate from COVID-19? Now, I shared this with you yesterday, but I want you to understand, if you say to white America or to America, we want all these things because of the past, you're going to get people who will say, no, other people are suffering too. But you have new numbers. Let's work off the newness of where we're at. These new numbers that are right here, I'm going to play them for you. Let's read these new numbers. This is what we're going to learn with these new numbers.
Here is a saying: when America catches a cold, Black people get the flu. Well, in 2020, when America catches coronavirus, Black people die. Blacks in about every state with racial data available have higher contraction rates and higher death rates of COVID-19. In Michigan, Blacks make up 15% of the state population but represent 35% of people diagnosed with COVID-19. This means that Blacks in Michigan are 133% more likely to contract the novel coronavirus relative to their percentage of the state. With a death rate hovering near 4% in Michigan, Blacks are also overrepresented for deaths related to COVID-19, accounting for 40% of all deaths statewide. For comparison, whites represent 25% of people diagnosed with COVID-19 and 26% of deaths. Whites make up over 75% of the state population. In Illinois, Blacks represent about 16% of the state but 30% of people diagnosed with COVID-19. In Chicago, Blacks represent 70% of people who have died from coronavirus. North Carolina, South Carolina, and New York show the same pattern with slightly smaller gaps. Among the 4 states shown below, Blacks are 74% more likely to contract coronavirus than their percentage of the state. These disparities are likely to continue as the virus spreads to new areas. The coronavirus has not even hit rural America hard yet, where many counties do not even have a single hospital bed.
Okay, and then it goes on and talks about Louisiana and Milwaukee and the deaths that are dying there. I'm going to give you a link for this article because I don't want to continue to read it all throughout. But this young man has data. This is current data. These are current devastating numbers that could affect our national number, which they are doing. Because we are at 13-12% of the population. This could take us down to 9. So unless we step in and do something about it, then we're going to have problems. We have to ask for help. I'm going to take you back in history. I want to show you something. Let me bear with me as I play on the computer with this one. Let's see. Let me go ahead and I'll chime out for a second while I type all this in. I want to show you how we saw in past history how they came along and they helped us during a pandemic. And they helped us and they particularly the president's position stepped in and intervened for us. And so I believe that we need to correlate back to that era to show them, you see, we were affected the worst then as well. So if we were affected the worst then as well, we need to be doing something about it. And they did do something. Is this administration going to do the same? That's all I want to know. Is this administration going to do the same as what we were encountering back then regarding the pandemic that took place? Because the pandemic during the Roosevelt era really affected us. And it was a group that were together called the Black Cabinet. And the reason why the Black Cabinet was assembled, because President Frederick Douglass and his wife knew that there were some problems that took place. And this council group was put together to help the large problems within the Black community during the wartime. It also had to deal with the struggles that were going on within areas of the South, of the white congressional Democrat areas, where these blue states, and see, this is the same here, same issues you're having now. It's where a lot of these blue states are being the most detrimental, especially within the Black community, and how it's dealing with things. But I want to show you a little history that's important because it correlates to where we are today. But if we don't know history, we can't move forward. And we don't know rights that were given to us, we can't move forward. So this is called the Black Cabinet. Let me go ahead and let you see this. And this was, and it's very clear, it wasn't a lot of immigrants back then. So Black America was very clear. You don't have to do all those distinctions that we do today.
The Black Cabinet, or Federal Council of Negro Affairs, or Black Brain Trust, was the informal term for a group of African Americans who served as public policy advisors to President Franklin D. Roosevelt and his wife Eleanor Roosevelt in his 1933-45 terms in office. There was no official organization. The term was coined in 1936 by Mary McLeod Bethune and was occasionally used in the press. By mid-1935, there were 45 African Americans working in federal executive departments and New Deal agencies, too.
See, they had to position us because we demanded these positions. Now, let's learn a little history of this. Now, I want you to see these because these were troubling times, and why these people were put in place. Why were these people asked to come about?
The council was concerned with civil rights. Franklin D. Roosevelt believed there were larger problems to be addressed than racial inequality during the wartime years. He was also struggling to maintain the support of the Southern white congressional Democrats. Roosevelt declined to support legislation making lynching a federal offense and banning the use of the poll tax in the South. The Black Cabinet, with Eleanor Roosevelt's support, worked to ensure that Blacks received 10% of welfare funds. The council argued that Blacks were underrepresented among recipients of aid under the New Deal, in large part because Southern Democrats had influenced the structure and implementation of programs to aid their white constituents. For instance, the Agricultural Adjustment Administration helped farmers but did not help farm workers. Farm owners were given the incentive to cut farm production, reducing the need for labor. Programs such as the Works Projects Administration, WPA, and the National Youth Administration, NYA, attempted to direct 10% of funds to Blacks as their proportion of the U.S. population. These agencies set up separate all-Black units with the same pay and conditions as those in white units, to which Black voters responded favorably. Mary McLeod Bethune served as an informal organizer of the council, as well as the director of Negro Affairs in the National Youth Administration. 3. Rayford Whittingham Logue drafted Roosevelt's executive order prohibiting the exclusion of Blacks from the military in World War II. Other leaders included William H. Hastie and Robert C. Weaver. The leaders associated with the Black Cabinet are often credited with laying part of the foundation of the civil rights movement that developed in strength in the post-war years. The council tried to create jobs for unemployed African Americans and to create more opportunities for them. Still concentrated in rural areas of the South, Blacks made up about 20% of the poor in the Depression era. They were often the first to be let go from industrial jobs. Most of the Black community did not benefit from some of the New Deal acts. The WPA created agencies that employed creative people in a variety of jobs, as writers, artists, and other photographers. WPA murals were painted and WPA sculptures were commissioned for numerous federal buildings that were constructed during this period. Photographers documented families across the South and in northern cities. The Federal Writers Project paid its workers $20 a week, and they wrote histories of every state in the Union, covering major cities in addition. 4.
Okay, now listen. The New Deal Act. They had to come up with a new deal because during that time of history, African Americans were the most affected. Okay, we were the most affected. So they came up with this patent. They came up with this organization. They were noted to be called. There were no formal organization called. It was called the Black Cabinet. And God bless Mary Bethune Cookman because she understood the importance. Who was a Republican, who consists of these men who were Republicans, by the way, because the Democrats did not want to stop the voter tax, and they did not want to stop. The Democrats supported lynching and federal offensives. This is what I'm trying to understand. What you people don't understand, all you people who are Black Democrats, you don't understand that your culture of living in democracy, of ideology, of American history has come from lynchers and tax poll. We would have to pay taxes on voting. It's the craziest crap. But the point I want you to understand, I need you to do your homework, because see, there was the Black Cabinet, there was the Federal Council of the Negro Affairs, and the Black Brain Trust. Okay, we need this to come back. We need to have organizations like that. And that's what me and Angela, a couple of us, are working together so that we can help you understand that history is repeating itself. We are being suppressed during oppressed times, pandemic times. We are being stepped over now. And now illegal immigrants have been given more rights than us. Can you all understand what I'm saying? I know this may seem confusing for some, but for us who have lived this history, we get it. We get it. And I know that you get this, but we've got to simplify our message, because we do a lot of venting and we do a lot of sharing of information. But to get the White House and to get the local state governors and mayors to come on the same page as us, I think there needs to be a who, what, when, and where. Who are the people most affected? African American. Where are they affected? In urban communities. Why are they affected? Because of the imbalance of not having the free labor as other people, of being not able to get jobs, as far as housing, as far as health and nutrition. These are the things of the what and where and why. And why do we need it? We need it now because our people are dying at a rate that are uncontrollable and higher of any other human being, of any other higher culture on this planet. And then we want to be compensated. So for me, I'm working with our team. I want to get feedback. Please email me at shirleyhussar@gmail.com. These videos are for us to have an understanding of where we need to be going, and a communication line so that we can break this simple and break it down quickly, because we have to start having these videos and have something quickly on the table to give our legislators, local, state, and federal. And as urban game changers, as activists, we have to change the game for our urban communities. Otherwise, when the world does eventually open up into urban communities, our people are going to be smoking more weed. We are being more set back. Like Angela mentioned, in Los Angeles, all the management jobs are Korean and Latin communities. And then the governor right now, he speaks everything in English and Spanish. We should not be speaking any other language but American English. We should be speaking English. But again, if we're going to be trying to be catering to other cultures, we're not even on the thought pattern. We're not even a template on the table when we are the most hit by this pandemic. That's a problem. The only way we're going to be able to have a louder voice at the table is unless we say something, unless we produce something. And if we're not producing anything, we're not going to make a difference. We are truly disadvantaged. I totally agree with you. And we do need that think tank. We do need that think tank. You know, Dr. Anderson had a chance. He spoke with President Trump. And I want to say this about him. And I think he's a great guy. But he said that he wanted President Trump to read his book and da-da-da. That's not how Washington works. They're not going to read your information. They need a very clear, simple, not complex. We're too complex already. We are a very complex cultural people. I get that, but you have to do something more simplistic. You have to put something on the table that's simple and easy so that these things can be palatable for them as well as for us. But we have to start somewhere. So make sure you guys, if you have any input or idea that you want to be part of the think tank, we are going to have a separate show, but it's not going to be on YouTube. I'm going to give out a private conference number that you can call into, but you have to email me and let me know if you want to be part of that. And that will be a private conference call that we're going to be having to break down what we need to present for our agenda. And if you want to be part of that committee, please email me at shirleyhussar@gmail.com. That's shirleyhussar@gmail.com. You see my name, Shirley Hussar. So if you just do shirleyhussar@gmail.com, some of you have already emailed me and said, hey, put me on that, put me on that. And then I will put you on that conference call. And in that call, we're going to talk about the who, what, when, and why, and put in a format of a who, what, when, and why to simplify a nice open door for us to have a conversation. And then when we have that conversation, we will bring a stronger execution platform of monies that need to be allocated. Because if you're going to give trillions of dollars state nationally throughout America to these foreign people and not give us something, that's a problem. And within California, if you're going to give where we're at, if we combine ourselves with the Pan-Africans, if you're going to look at 9 or 10% of the population, African American and Africans, and you're not going to give us anything, and we're the most devastated culture-wise, but you're going to give the illegals 10%, basing them on them being 10% of the operation of California, according to Gavin Newsom yesterday, and you're going to compensate them for $125 million. We need to speak up, because that's your tax-paying dollars going to help another culture of people, and that is a red flag. Make sure you guys follow me on Facebook, Twitter, Instagram, and Snapchat. Thank you for tonight's show. It was more informative for you to understand that we as the nation of people should talk about what we need to bring to the table to address this pandemic regarding our particular culture of people. The more we know, the more we grow. Remember what I always say, keep your head up.